Understanding about over-exercise, I think we should know what are the kinds of exercise. There are two types, basically, it's moderate intensity and high intensity. Moderate intensity is what, when you are, in simple terms, when you are doing an exercise with your friend or somebody, when you can have a decent conversation with him. That means you are not so breathless. That's called moderate intensity exercise. In scientific word, there is something called a target heart rate as per your age. You are pushing it not beyond 80 or 85% of your target heart rate. Now, what are the kinds of moderate intensity exercise, like walking, cycling at around 5 to 10 miles per hour, double tennis, and these are moderate intensity exercise. Now, moderate intensity exercises, there is an ample evidence to suggest that it helps, reducing your cardiovascular events like heart attack. It reduces hypertension, diabetes, and there is immense amount of benefit when you do every day when you do a moderate intensity exercise. And of course, when you are doing a moderate exercise, we don't expect any high incidences of cardiovascular events like attack or something like that. Now the question comes in high intensity exercise. Now what is high intensity exercise? When you're doing an exercise, you wouldn't be able to say more than few words. Or you are pushing your heart rate, target heart rate beyond 85-90%. So these are intensity exercises like playing singles tennis, running, jogging, any professional sports. These are all high intensity exercise. Of course, the cardiovascular benefits are there, but it is not so much as you get in a moderate intensity exercise. Like, let's say you are doing a moderate intensity exercise, and if you are increasing it to high intensity exercise, the beneficial effects is not going to be the same. So, but when you are doing high intensity exercise, there are incidences of these kind of heart attacks, cardiovascular events, and all those things are pretty common in high intensity exercise. Although I am saying it is common in the sense that absolute numbers are still very, very less. So, how many professional athletes you would see having a heart attack when they are, involved in any games or something? So it is about, when you are even talking about over-exercising or high-intensity exercise also, it is about how you train. A well-trained person is very unlikely to develop a problem. A ill-trained person who doesn't do a structured training, or who has risk factors, or who has symptoms in the past, are likely to develop complications doing this. So if you do it well, if you structure your programs well, if you start slow and pace yourself in a correct manner, or you are guided when you are doing these kind of high intensity exercises, still the incidence of any problems are very, very less. So when you are talking about moderate intensity exercises, in short, is very, very beneficial. Anybody can start without any much supervision. When you are doing high intensity exercises, in certain individuals, high intensity individuals, it is better to get a screening done, and if not, you pace yourself well, you structure your programs well, the incidences of heart-related complications are pretty less.